Hi guys. Today I'm going to deliberate upon something that is much feared by all of us, but we have no inkling of how to combat this disease. It's not a disease per se, but it might lead to the floodgates of other diseases. That's called obesity. As you see on the screen, obesity is excessive body fat, and is a clinical terms a person who is with a BMI greater than 30 kg and square is called obese. Now this is a kind of average measurement of the height, body weight, and expected amount of carbohydrates, fats, and those kind of unnecessary, undesirable elements that get accumulated over the years and that start inhibiting the smooth functioning of anabolism and catabolism. And obesity occurs when greater quantity of energy enter the body than expended. Then expended means that can be managed. Weight increase since most of the excess energy is stored as fat in the body, so for each 9.3 calories of excess energy that enters the body, approximately 1 gram of fat is stored. Now, with this kind of accumulation and kind of storage of the unnecessary fat in our body, this is going to really cause a lot of issues in the end over the years. I mean, like how to determine obesity. Now you can see in the picture is the body weight deficit. Then we have the norm 18.5 24. We have weight over 24 to 30. Then we have 30 35 obesity first degree. I mean, is the beginning of obesity. If we're reaching 35, and then we have the obesity second degree. That's a kind of slow accumulation deposit of, let's say, like 35 to 40. And when you reach the 40 plus, I mean above 40, that's the third degree of obesity. That's an alarming state of fat. The BMI is calculated as BMI is equals to weight in kilograms upon height in meters square. So BMI is not a direct estimate of adiposity. Adiposity is accumulation of unnecessary material, unnecessary glucose and carbohydrates and fat. And so BMI, a better method to define obesity is to measure the total body fats percentage. So I mean, in obese people, like if you are living a sedentary lifestyle, and these could be the causes of you're not up to the maximum level of hyperactivity, physical activity, and your decreased muscle mass and increased it is leading to muscular fossilization and inactivity. And in obese people, increased physical activity usually increases energy expenditure more than food intake. That means you aren't really exhausting or really spending the energy. In fact, you are accumulating food inside your body, and that's not being managed. So, and that's resulting in significant weight loss. And one episode of strenuous exercise, I mean, like if you have one episode of intense and vigorous exercise, that will increase basal energy expenditure for several hours. And after the physical activities are stopped. So we need to really increase the kind of activity that we have to, I mean, that really help us in affecting expenditure of the accumulation of the. So increased physical activity is the most effective means of reducing fat store. And if we stop living the sedentary lifestyle, I mean, reclining chairs in the sofa, being a couch potato, watching TV most of the time, and not responding to the errands, and not doing even the usual chores of the day, and thinking, I mean, gulping down foods like junk food without having to worry about what we're eating, how much we're eating, when we're eating. So that's really, that would cause a real issue then ultimately. So we need to cut down on the intake of those energizing foods, especially carbs, which has more of sugar, sucrose, fructose, glucose, and we need to have more of refuges in our foods. Refuges might include the coarse grains, millets, and we need to avoid the processed food that's readily available, and we have to really withdraw from our temptations, and we are always seduced to consuming ready foods with lots of sugary drinks and lots of add-ons on, because most of these fast food chain restaurants, they keep offering you plenty of foods on your palate, plate, and then that tantalizes the palate, that's the problem is that then they are hygienic, they are prepared with utmost care of cleanliness, and but the thing is that we get easily hooked over the time, and we keep consuming on, and the consumption level goes really high, and we start thinking of so the problem occurs when we're not judiciously intaking the foods, and we continue to be negligent about not only the amounts but also the kind of so the thing is, we have to take care of this kind of living, in a forlorn manner and in a sedentary life without having to bother about what, how much, and there is another factor that's genetic, and the genetic factor could be hereditary. I mean, you have already inherited the disease because your forefathers and parents or successive generations. So the obesity was running in family, and that was further compounded with this eating habits. So 20-25% of the cases of obesity may be caused by genetic factors, and genes can contribute to obesity by causing abnormalities of one or more of the pathways that regulate the feeding centers, energy expenditure, and fat storage. So These abnormalities might result in lots of medical conditions later, and the conditioning happens when we start, abnormal feeding behavior, and we keep tending to, physiological, this behavior might include physiological, the way you behave, act, or use the body. It could be environmental, and it could be psychological factors called abnormal feeding behavior, like you suddenly get up at night and then they start rummaging the fridge, and you start gulping down any sugary items, and that's something that you really dote on. So sedentary lifestyle due to environmental urbanization, like when we live in cities, it doesn't allow us much to walk down the paths, and we live a very busy life full of commitments, and where our health remains unnoticed or ignored. So weight gain is stressful situation. When we are stressed out, we tend to consume more of the food, and this more consumption of the you don't have time to spend it in energizing way. So even disease might start with childhood overnutrition. Like some parents, they believe and think as if it's their duty to feed as much as possible to their growing children. The rate of formation of new fat cells is especially rapid in the first few years of life. So fat cells, they do grow phenomenally in the inception, at the beginning of the life itself. And the greater the rate of fat storage, the greater the number of fat cells. And the number of fat cells in obese children is often as much as 3 times that in normal children. Therefore, overnutrition, especially in infancy and to a lesser extent during the later years of childhood, can lead to a lifetime of obesity. Once your fat cells start, having homes in your body, now it's very hard to quit those. There could be some other causes like neuroorganic abnormalities. Now, obesity in human beings can result from damage to the hypothalamus. Abnormalities of neurotransmitters or receptor mechanism may also be present in the neural pathways of the hypothalamus that control feeding. That means the brain triggers the appetite, and it regulates how much and how long and how you're going to manage the consumption of the food. An obese person who has reduced to normal weight by dieting develops intense hunger greater than that of a normal person. So obesity, obese person has a predisposed tendency towards, having more of appetite and hunger than the normal person. So diet-induced weight, like if you go on dieting and then you're trying to lessen your weight and trying to lose the weight, is accompanied by increased level of hunger. That means you will have stimulating hormones that will tell you to consume more and more. And the decreased levels of hormones, leptin, that reduces hunger. That means you will have lesser hormones, leptin hormones, that controls hunger, and you will have more of your hunger propensity or predisposition towards eating, consuming all the time, every time, and it would be hard to control your insatiable appetite. So what are the health risks of being obese? Like obesity can lead to a high blood pressure, which is the leading cause of stroke, increased depression. Obesity affects mental health. That means you will not have a feeling of well-being, and you will have lots of worries, concerns, and depression, and issues with body image also. Like people would laugh at you. You always be suffering from syndrome of inferiority complex, that you're being one singled out, you are different from others, you need more space to sit, you need a little more time to walk, more time to adjust to the social milieu. And this is the psychological, mental health that causes depression. So high blood pressure, blood sugar hardens arteries, and then hypoglycemic. I mean, you will be hyper or hypoglycemic, and your glycemic index will rise, and that increases the chances of heart attacks even more. It also leads to excess fat buildup around the liver, hepatoma. You'll may have damage to your liver failure. There are more risks with obesity, like cancer. And obesity has been associated with cancer like liver cancer, hepatoma, kidney, nephroma, colon, and pancreatic cancer also. So the likelihood of having these kinds of carcinogenic cells in your body increases much faster, higher, and you could also suffer from gastroesophageal reflux diseases. Like obesity is higher risk of GERD, where stomach acids leaks into esophagus, and that also has resultant impact on infertility. And this is another health risk of, and obesity makes it difficult to get pregnant among women and increase the risk of complications prenatal, postnatal, even cesarean and birth, and in the malnutritions, or the baby could also develop some sort of abnormalities. And so there are lots and lots of health risks, like joint pain, and excess weight puts strain on joints. Our joints are not made for carrying too much of loads, and it causes pain and stiffness. I mean, bone joints, they lose the flexibility, the ligaments start pulling, pushing. And worst case scenario could be the kidney failure. I mean, nephrology, high blood pressure and diabetes can also lead to chronic kidney diseases. So you may have to go for kidney transplant. I mean, you may have to have ectomy, removal of, or maybe you have to preemptively go on dialysis. That's artificial, discharge of the waste material, urinary, and from the body. Type 2 diabetes is quite common among obese people, and it makes more body-resistant insulin and leads to high blood sugar. So when your body organ stops releasing insulin, you may have to go for artificial injection of the insulin, or may have to be on medications and lifelong medications. The skin for rashes, another resultant impact of discolored and thickened rashes occur where the skin folds and creases. That means your skin will lose the tone, and you will have epidermis, dermatological problems, flabby skins, and I mean, there are lots and lots of complications if you continue to consume a lot of fatty acids, and it gets accumulated over the years. You become obese and overweight, then obese, and then it gets to a point where it's really hard to manage. And even the treatment of obesity could be quite complex. It's a kind of management. It's kind of management. It can be altered or modified. It really takes a lot of pain and hard work and strenuous exercises if you're not really careful at the start of your career. In fact, even the childhood fat acids, right from the childhood, overeating, overfeeding, or extra care, overnutrition is a cause of it. It's a blessing in disguise. And in fact, lesser the you eat, the more chances of your staying healthy. So exercise with dieting. So treatment of obesity by either reducing energy intake, either you cut down on the consumption level or increasing energy expenditure. Either you burn your accumulated fats or calories, and you know that is a normal human being just require 2,000 calorie to survive. But if you are accumulating one Big Mac burger will give you 800 to 900 calories, and it takes an hour or so of strenuous walk and jogging or running just to assimilate or just to digest that. So to decrease energy intake, diets have large quantity of non-nutritive cellulose substances. So such diets which do not contain lots of cellulose, you have to go amylase, whole grain wheat. We should have for coarse grains, and this bulk distends the stomach and thereby partially appeases hunger. So that means stomach has to be full, but without much of. So what is needed is a complete discharge from your body outside in the form of feces and form of other. So it's important to prevent vitamin deficiencies, because the bone density, the stiffness of the bone decay, that starts early on. So you need to take care of your bones and vitamin D. The more exercise one gets, the greater the daily energy expenditure, and the more rapidly the obesity disappears. I mean, it doesn't disappear overnight. I mean, it takes a lot of time and energy and a sustained level of efforts to get rid of this accumulated fat substances in the body. So lifestyle modifications include probably increased physical activity combined with a reduction in caloric intake. I mean, reduce your calorie intake, don't overeat, and then you may have to go for some medications. And like, what kind of treatment available to combat obesity? Drugs for reducing degree of hunger. So to begin with, these drugs, they help quench our thirst, our appetite, and it just reduces the craving for hunger, craving for foods and all. So amphetamines directly inhibit the feeding centers in the brain. That means the brain will tell you not to eat, or will tell you to reduce the intake. I will tell you to eat less or less frequently. And it's like brain commands all of our activities. Phentermine plus topiramate and sympathomimetic, they reduce food intake and increases energy expenditure, along with an anticonvulsant drug. So lorcaserin, that activates serotonin receptors in the brain, and serotonin, I mean, you know, serotonin tells us about cravings and promotes increased POMC expression. That means there should be a mechanism in your mental order and your psychological order that tells you not to get hooked, not to get addicted to overeating, overconsumption of the foods, and your craving for the food should be minimized. Another group, drugs, works by altering lipid absorption in the gut. I mean, there are artificial ways of doing, parting your stomach in two halves and reducing the intake of food, but those don't work ultimately, because we will have issues when. So even there is a liposuction, that the one way the fat elements are removed, sucked artificially, but you tend to gain them back over the years. That's a problem. Another group of drugs works by altering lipid absorptions of the gut. Now, some of the treatment of obesity, when it's coming to surgery, those are the extreme measures. That's not really advice for the common, for those people who want to live a healthy, complaint-free or complications-free life. So surgery is for morbidity obese patients, like with BMI greater than 40, extremely high, or for patients with BMI greater than 35 and conditions as hypertension or type 2 diabetes, there is a possibility of surgery to decrease the fat mass body, decrease the amount of food that can be eaten at each meal. So what kind of surgery is available scientifically is called gastric bypass surgery. Pouch is separated from the remaining part of the stomach with staples. That means there is a partition, the compartment in the stomach, and part of the food is allowed to go in, part of food is not allowed to go in. So gastric banding surgery creates a small stomach pouch that restricts the amount of food that can be eaten at each meal. And then we have vertical sleeve gastrectomy. Removes a large part of stomach with the remaining part stapled back together. So these are some of the extreme measures that one could opt for. But to begin with, my strong recommendation, advice would be to alter, modify the lifestyle and try not to overeat, try to restrict from indulging in delicacies, and try not to consume a lot of processed food, and try to include, we need to try to include more of physical robustness, physical activities in whatever form is possible. To begin with, we can start with a small measure, a few steps towards achieving our goal. It could be 10 minutes, 20 minutes. It could be alternate day. It could be 3 days a week. It could be, you could skip safely the weekends, and it could be, like a lightheartedness. A small step might lead to giant strides in the future. And anyway, it's our machine, it's our own body, and only a healthy mind lives in a healthy body, and a healthy body lives in a healthy mind. So why not, take good care of it? Because if we want to lead our life without depression, without without having to, visit doctors more often than, gyms, we must start hitting the street. Let's get the street, ground hitting, and start taking the first few steps towards improving our health condition. And also to get your family and other members into confidence so that they could contribute and they could also lead a healthier life than, because this modern lifestyle, which is really taxing, demanding, and it keeps us on our toes, but in a wrong sense. We're seated in a chair, we are all the time, driving, we're sitting in our cars, we are, using elevators instead of staircases, and we are forced to use, lots of, we have beverages all around, we have foods, plenty of food. The problem is that we have abundance of food. It's not a scarcity. Maybe part of the globe, people are dying out of starvation, but those people who are obese, they actually have plenty of food, and abundance of food is a problem. So I'm wishing you a healthier well-being, a healthier mental makeup, a much more toned body, and I wish everyone a grand and a very successful, healthy living. With this well wishes, I'm going to stop here now, and probably I might come up with other issues, which health-related issues, in our coming videos. Thank you so much.